Welcome back to the show, everyone. We always get great reaction when we have our next guest on because she talks about a subject that fascinates people.
Absolutely. You've heard of Botox and Restylane and all the rest of it, but what else should you get done and how much and how many treatments? Dr. Francis Jang is joining us now to tell us what is new in the world of dermatology.
Francis.
How are you?
Right. Very good.
So what are we
Nice to see
talking
you.
about today? Happy New Year to you too.
Well, a few different things, just little bits and pieces, but one of the big things I want to touch on is about combination therapy. And what I'm really talking about is that combination of using things like Botox, which has been around now for over a decade, fillers, things like Juvederm and Restylane, in combination with skincare and laser work.
Do all these treatments work better in combination?
Yeah,
I mean, obviously result-wise, but in terms of...
You'll get optimum results, and we now really understand that it's not just in the short term preventative or corrective. Really, we are trying to stop the clock and prevent people from maybe even having to contemplate having surgery.
And I guess people are starting to do the fillers younger, so the big surgeries that are drastic later aren't as necessary.
Well, because we realize that things like Botox are preventative, we are starting to see more younger people coming into the office. And you know, the safety record is out there. We've been doing it for a long time. We can actually prevent them from ever developing.
Well, and preventative is you know, it's an interesting word for people because moisturizer is preventative and using the proper moisturizer.
Sunscreen.
So, I mean, obviously this is an extension and it's sort of an acceleration of what we're talking about,
Absolutely.
but it's really
So
the same concept.
It's beyond skincare molecules, you're right, but it does go down to those things as well. So it's a combination of all that.
Okay, let's look at our first photo. We're looking at a man. Tell us what we're looking at here.
So here's a 50-year-old gentleman that first came to me because he had lots of sun damage. He's fair and he's spent quite a bit of time outdoors. And that's the other thing. We're seeing more and more men kind of realizing that they can take some opportunity to get some of the benefits from the things that ladies have been enjoying for the last decade or so. So you can see he has a lot of scattered red marks all over his face. We recognize these as dermatologists as being what we call actinic keratoses, or little precancers.
Note the dates at the bottom as well, 2009
So this is
2012.
2009, and we did a laser resurfacing procedure with him with a Fraxel CO2 laser, the so-called repair. And you can see that after he's had the treatment in several months, I didn't give you the acute or the short-term follow-up to the laser resurfacing, but you can see even after a couple of years, he looks pretty good, clear.
And he got the laser resurfacing done, but he also got fillers as well.
And then he said, yeah, this is good. What else can I do? I'm feeling kind of middle-aged, and well, let's do a little Botox in between your eyebrows, and let's give you a little bit more fullness in here because you're starting to look flat.
And it's subtle.
And we did it in a very restrained way. So he feels fine, he doesn't feel done, and he feels much more healthy and feels better looking, and he's much more self-confident.
Often come to you, and I guess that would be changing now, with the idea of a long-term plan and not just a, hey, I've got some lines, I want to cover them up, but what am I doing as I go forward?
Clearly it's about evolution of the aging face. So that's our job, to sort of be able to treat people initially and then guide them through the process for as much or as little as they want to do over time.
And let's go to our female here. She has classic sun damage, rosacea, wrinkling, thin lips. I can't believe on the left and the far right.
I was going to say, once again, notice the dates down at the bottom. That's an important little part of this whole exercise, 2000 to 2012.
Yeah, so she's a great client because she's 35. She's feeling a little bit self-conscious because, of course, she's seeing the sun damage, being fair. She's got a little bit of rosacea. And so she comes in initially just to have that dealt with, but over time she realizes that she likes what we do, so she starts doing a little bit of Botox, a little bit of filler. You'll notice her upper lip is very thin, but we've been able to restore it to a more normal looking lip over time. And at age 50, you can see she looks fabulous. She doesn't really walk around looking like she's had anything done, but she looks very healthful.
It's interesting because you can see that she's aged, but she looks better, but she also looks like a 50-year-old woman. She doesn't look like...
She looks healthy and vibrant.
She really does. Okay, let's go to hands, because hands age too, and it's amazing.
I want to show you mine.
These are your hands in the photo. What did you do?
But look at these hands.
We can see veins on the left hand.
Okay, hold your hands up again.
Okay.
There we go.
See my wonderful 50-plus-year-old hands.
50-plus, first of all.
So, tendons, veins. I don't have a lot of brown spots, but we see that starting to appear in younger people, in more fair-skinned people. So what we did last Friday was put a little Restylane in here, not a big deal. So there's still a tiny bit puffy.
And you can't see
the veins. But you can kind of see, the veins have disappeared, and the tendons, we probably have to do a little touch-up here, but if you just look at it, it looks much more youthful. And I want to get Madonna in my office.
Yeah, her hands need a little...
I mean, that's sort of the test case when people think about it, because she has, you know, obviously had some stuff done, and she's done the preventative treatments and everything on her face. And sometimes when she does interviews, she goes like that, and she holds her hands up, and it's like that juxtaposition all of a sudden.
Yeah, there's a little disconnect there, and I think really her plastic surgeon or dermatologist needs to talk to her and sort of get on to the other areas, huh?
Okay, let's talk about something we keep on reading about, nicknamed the vampire facelift. Explain what this is.
Well, a little bit, if you look at the photograph, kind of people think of this, that they're going to get the vampire facelift and look like this. And, you know, it's really too bad because I think it has a place in what we do. So it's basically taking your own blood and then spinning it down. It's just like taking blood in the lab. We put it in a test tube and we spin it down in what we call a centrifuge, which separates off the red blood cells and the plasma, which is what the clear colored fluid that comes out of your knee when you've
got a scrape or
And that stuff has growth factors, as we've determined, that help thicken the skin and heal skin. So we then take the plasma and we put it in a syringe and we inject it back into the skin.
So your own blood?
Yes.
And does this all happen within one treatment, or do you go away a couple of days? Or?
No, we just do it right there.
And it's common for crepey skin, thin skin?
So initially, when it was first promoted, it was promoted as a facelift. People were putting it everywhere in hopes of achieving this, you know, beautiful look. Unfortunately, it didn't lift quite as much as we wanted. So really, we haven't found anything to quite replace the likes of surgery. However, where we have found it very helpful is in that crepey thin skin under the eyes, either because you're very fair or thin-skinned or postmenopausal skin. We really start to notice that crepiness. And really, prior to this, we only had lasers, which would do it, but the lasers were kind of, they thickened the skin, but they were fraught with a lot of recovery time and months of redness in the skin. Well, this does it. Yes, you get a little bit of bruising, possibly, and a little bit of swelling, but really within 6 to 8 weeks, you get this nice thickening of the skin. So
and we've got
I have
a before
somebody here, and
yes.
It's a little bit more subtle result. It doesn't fill the area, it actually changes the quality of the skin.
Interesting.
So there you see a 40-plus-year-old woman who's fair, who's got a little bit of that very fine lining in her skin, and even if she's doing Botox in that area, it won't really resolve that problem.
Right.
And so here, after the treatment, I think she's 7 months, so the PRP, so we call it platelet-rich plasma, is a better name for it.
You're not calling it a vampire facelift?
It is a better name for it.
And you can see that the quality of her skin is a little bit thicker. I mean, it's not absolutely gone, but it's certainly better, and I think the pictures don't really do it justice, because I think in real life...
And the efficacy of this in terms of timeline?
Well, we're not seeing patients 1 year, 2 years out, and they still look very good.
Oh,
so, but it will clearly gradually deteriorate. But what we think we're doing is actually thickening the skin by creating new collagen. So it takes the collagen quite a while to break down.
Well, thank you, Dr. Jang. Always nice to see you. If you want to talk to Dr. Jang or get your own consultation, you go to her website or visit Skinworks.
Very nice. We're going to take a break.